As a Medicare beneficiary, you may have found yourself asking, can a physical therapist or other type of therapist like an OT or a speech language pathologist come to my home and do therapy with me here instead of having to drive across town to go to a clinic? If you've wondered that, this video is going to address that specific question. Before we get into the material of the video, please be sure to hit that like button, smash it, and subscribe to the channel. And also, please let me know in the comments what your experiences have been with home-based physical therapy, or if you desire to have that done, what your questions might be. But I hope to address most of those questions in this video. So without further ado, my name is Dr. Michael Hyland, physical therapist. Welcome to the video. So today we're talking about home-based physical therapy. You might consider this mobile physical therapy, concierge physical therapy. You may have heard those terms before, but basically, whatever you want to call it, it's the therapist coming to you at your place of residence, whether it's your apartment or assisted living facility, independent living apartment, or your personal home, a house, in other words. So one thing I wanted to say, first of all, just to distinguish this, we don't want to get confused between home health and mobile outpatient physical therapy, because there are two distinct avenues. Home health, traditional home health, is under Medicare Part A benefits. So inpatient is what Part A covers. So hospital stays, skilled nursing, rehabilitation, and inpatient rehabilitation, and home health. Whereas in this case, we're specifically talking about outpatient physical therapy delivered in your home. Basically, there's more than one type of person, but there are two types of individuals I have in mind who typically seek therapy in their own home. Number one is a person who may have gone through traditional home health, has been discharged because they're no longer technically medically homebound, but they still have a restriction of some kind or limitation or a burden in leaving the home and going to an outpatient clinic to get therapy. The other type of person simply wants it for convenience. They can leave the home anytime they want, but they'd rather have somebody come to them. The good news is Medicare will pay for this. The difference is it's under Part B benefits. So it would be the same as if you went to your neighborhood physical therapy clinic, except it's billed as a visit in your home. So what I wanted to tell you is it's very easy to get done, and I wanted to let you know what the requirements are under the regulations for you to have this covered by Medicare. Number one, depending on your state, you may not need a referral. Many states allow direct access for your physical therapist to come do an evaluation with you. And once that evaluation is completed, they can start treatments as soon as available. They just send the plan of care to the physician for signature, and it's whatever physician you're under care of. It doesn't have to be a primary care. It could be a surgeon. It could be a specialist of some kind, like a neurologist, for example. But the evaluation does not necessarily need a referral to get done. You do need a plan of care certified by a physician, some practitioner that's caring for you, in order for that therapy to be covered by Medicare. Physical therapy, outpatient physical therapy has some misunderstandings behind it. And I think a lot of clinics out there, through no fault of their own really, they operate under a mindset of having a limitation on how many visits you can do under Medicare per year. Medicare used to have a hard, well, they called it a hard cap. I think it was somewhere around the neighborhood of $1,800, $1,900 for speech and PT combined, and the same amount for OT separately. That's a long story about why that's combined. But anyway, right now it's a soft threshold, they call it. There's no cap anymore. They've gotten rid of that. It's a soft threshold. So you have $2,110 available for PT and OT, physical therapy and speech language pathology combined using that amount, and then $2,110 for OT. So that is the amount that Medicare will allow per year to be billed without any further documentation. And above that amount, you can still get physical therapy, especially if it's medically necessary. You may get through 15, 20 visits, and there's still something that needs to be completed. Maybe there's still fall risk or balance issues, or there's still a high level of pain associated with injury or post-surgical cases. Whatever the case may be, if it's medically necessary and it's justifiable in the documentation, you can continue therapy beyond that $2,000. And again, that's on the billing end of the practice. So, each practice is going to have their own policies on that, but just know that it's possible to bill over that threshold as long as it's medically necessary. And that would be determined by your therapist, the clinician that's caring for you. The other thing that's important to know is that Medicare Part B has a deductible, and it's $233 at the present time. There are some supplement plans that cover the deductible, such as Plan F. They're not selling Plan F any longer, but Plan F's cover the deductible, as well as Medicare Part C, which is Medicare Advantage. So that's basically it as far as requirements. As long as there's medical necessity, you can have the therapy covered by Medicare, and that medical necessity has to be justified by your therapist. A lot of people will get to the point of getting through with therapy and they really don't want to stop because they've enjoyed the interaction with their therapist, the relationship. They've enjoyed, in other words, there's accountability there. They really like working with that individual and it keeps them motivated. But just remember, motivation is not medical necessity. And whether it's right or wrong, that is not something Medicare will pay for. So once you get through with therapy, you and your therapist need to have a serious conversation about moving forward. If you're a self-motivated person, you can keep doing your exercises, you can keep doing stretches, whatever it is that's been prescribed by your physical therapist. If that's not a problem for you, that's great. But there are individuals that want that accountability, they want that motivation. Excuse me. And for those people, there are other options out there. But in this video, for the scope of today's video, we just talked about home-based physical therapy, how it's possible, how it can be covered by Medicare, and that's going to wrap it up. I hope you found this video informative, and I hope it enlightened some of you that maybe have hoped to get some therapy in your home and didn't know that it was possible unless you had home health. And that's one thing I didn't mention earlier. Home-based outpatient therapy does not require a medical homebound status. So you don't have to be homebound to get this service. For home health, under Part A Medicare, you do have to be certified as medically homebound. So that's another distinction to make as well. Again, thank you for watching this video. Please let me know in the comments if you found this informative and helpful. And I look forward to seeing you in the next video. My name is Dr. Michael Hyland. I'll catch you in the next video.